mom of two parents, and I am interested in sport.
Fantastic. So thank you. That's really good to get a bit of an introduction. And even before I start the presentation, so there is a organisation called Sports Medicine Australia that actually runs some specific sports first aid courses in case that ever interests anybody. And you can qualify to a sports trainer level with them if that ever is helpful. Have some really good resources. I'm a fellow mum. I've got 3 boys, and I've just had a winter of 3 different sports, so hockey, footy, and soccer. So yeah, and was like you, even being a doctor, even being a sports doctor, concussion is a rare thing we see, and thank goodness researching for this. But yeah, I had a year 3 footy boy, our first taste into the footy season, and the first game was head clashes, and I was thinking, yikes. So I hope you can all go away with peace of mind or reassurance that I would love this to be in every single first aid kit bag, every side bag. So even if it's people that haven't been as enthusiastic as you guys and come along, parent can dig into that bag, at least know this is here, and it is very straightforward and very easy to just work your way through. You definitely don't need to be a doctor. This can be any parent, even not first aid trained, but obviously that is helpful if you are as well, for the emergency situations where we wouldn't even use this. I'd love this talk to be interactive. You guys have got so much experience. Please feel free to chip in any scenarios that have happened, any questions along the way, rather than saving them to the end. You're very welcome to raise your hands, and chip in. So that could work nicely. Lovely. So a little bit about how it will run tonight. I've split the talk into a few different sections, really. A bit about recognising concussion. I think that's a tricky thing. We all heard this term, but we're not really sure how we might diagnose it. A bit about game day management, which hopefully will be helpful for us all. I like talking a little bit about return to play as well, because I think we can diagnose concussion, we can manage it, but we've all got kids ourselves or know kids who they basically want to know, when can I be back on that pitch? When can I be back with my teammates? A bit about long-term consequences. I think that's what's come up a lot in the media, and that's where funding has come from to help with this. So we'll learn about that, and hopefully then we can also spread the words of the importance of recognising concussion and supporting athletes with concussion. And then a bit about, if need be, we've got a little bit of information about club concussion policies. I think if there's any legal things that your club might need, Melissa's happy to help you a little bit to find some information for that. And again, anybody on Teams, I'm happy for some questions. I think we thought they'd be at the end. Lovely. So this is really good timing. Every 6 or 7 years, an international concussion group meet and review the concussion guidelines. And they actually met in June of this year and released a new up-to-date SCAT. Hi, come on in, welcome. You're welcome to grab a couple of leaflets and sheets there. So the SCAT is a sports concussion assessment tool. That is a bit more in-depth than what I've given you here. I actually haven't given it to you. It's open access online, but it's 13 pages and it's done by a medical professional. So I didn't think that would be super relatable to you. It's worth knowing that is there, and that's what an AFL doctor would be doing in under the depths of the change room in that 15 minutes where a professional footy player is being taken off and is being assessed for a head injury. We won't be doing that. Even as a doctor on the side of a pitch of my kids, or even top level, I wouldn't really be doing a SCAT test. I was the doctor for Perth Glory coming down here over the weekend, and even then, I think it was a friendly match. There was a head injury. I just call it for times like that. If there's any, and we'll learn that a bit, but if in doubt, we'll sit them out. But yeah, so the higher pressure is at the higher levels. But it's for you guys just to be aware that SCAT is there. There is also something, they've released a new thing this year called a SCOAT, which is a sports concussion office assessment tool. So that's for that 72 hours plus afterwards, when you might be taking your kid, your athlete might be going to GP on the Monday, say, or Tuesday after a head injury on the Saturday. Just some assessment to see how symptoms are progressing, hopefully improving, and onwards assessments. I love this website. I've got a list of resources at the end. If you want to get access to anything to update your knowledge, Concussion in Sport is a fantastic website. It's got great sections for parents, for coaches, for medical professionals, and yeah, for athletes as well. So really, yeah, fantastic. I've watched lots of their videos, their webinars. I've used some of their flow charts and things, and I've printed some bits for you as well in your pack. So when these new concussion guidelines came out, or whenever a new set do, each of the major sporting governing bodies create their own set of practice guidelines. I was just reading the updated one for 2023 of the AFL and AFLW this morning. But yeah, in case it interests you in your own sport, it might be interesting to access, and they just make it more specific to your own sports levels. But again, often these are set at higher level athletes. So we'll start off having a little bit of a think about what is concussion. So concussion falls into what we medically term a traumatic brain injury. Thankfully, it falls at the milder end of the spectrum. So basically, traumatic brain injury describes any injury to the brain caused by trauma. Usually concussion results from some kind of impact. We always think about the head hitting the floor, the athlete's head hitting someone else's head, or them getting knocked into the head. But actually, we've really got to think it can be any force, anywhere on the body, even a knock to the body, even a taking out of the legs that causes enough of a force for the head to shake. So the head doesn't have to impact with anything, the floor or another person. But if it's shaken forcefully enough, even by a rugby tackle, there is potential for a concussive injury. So more severe end of the traumatic brain injury is the skull fractures, the bleeding. Again, we might not know at that point. We might see certainly any bleeding we'll see on this makes us definitely suspect a concussion. But yeah, that is things we should be initially keeping an eye out for, and that trumps concussion basically. A severe injury, we don't even worry about concussion. If someone's got such a bad injury, they've lost consciousness, we'll deal with concussion in 48 hours time. Let's treat them for what the acute injury is at this point. I hope I can help you to we can focus a lot on concussion, but it's really, I hope I can help you to remember that we've still got we're looking at the patient. Are they safe? Are they maintaining their airway and their breathing and their circulation before we do assess for concussion? The tricky thing with concussion is there is no diagnostic tool. We can CT scan, MRI scan someone's head, and we won't see a thing in concussion. It's a functional injury rather than a structural injury. It's kind of stretching of the neurons, maybe a little bit of inflammation in the soft tissues, but nothing that shows, unfortunately, on any blood tests or scans. But as with the plus side of that is, hence it recovers itself spontaneously, so recovers on its own. And that's just in medicine, in ED, in pre-hospital care, we use a Glasgow coma scale. Thankfully, sports concussion rarely affects somebody's level of consciousness. So yeah, a few medical terms, but it's a pretty complex process of what actually happens. Like I say, we think it's a shearing of the neurons, which are the nerve cells, by the forces, and probably some irritative or inflammatory mediators or tissues around that area. Thankfully, it often resolves spontaneously. It's usually a rapid onset of short-lived impairment of brain function, and we can use some tools to work out both the symptoms, which is what a patient is feeling, and the signs, which is what we see to help to make the diagnosis. Interesting thing, it definitely doesn't need a loss of consciousness to get a concussion injury, and if there is a loss of consciousness, that again trumps everything. That's getting them to an ED or an emergency review. So hopefully this was to demonstrate how what can seem like a fairly mild knock to the head can actually cause quite a marked concussion. So this is cricket. So obviously we're coming into the cricket season. This is obviously professional level, so the balls are bowled at hundreds of k's an hour. But even the commentators, I couldn't get the sound to be playing, but even the commentators are saying how it looked just like a little glance of the ball off his helmet, you'll see. But within seconds he's staggering and moved on. Poor, it's Will obviously, and excuse my pronunciation, but he's had multiple concussions, and it seems to be that each concussion that it takes a little bit less impact, unfortunately, for him to be suffering from, which can be a phenomenon that's known. So you just zoom in a little bit closer now. But see actually how well the team, the opposition team, but reacted to supporting him in that. Interest, but it's literally doesn't take a lot. And I guess in the sports that we're in hockey and in rugby, we don't have helmets either to be protecting us from balls flying, which they do in hockey, unfortunately, don't they, at times? I've actually skipped to the complications next because I think it helps us to realise the seriousness. I mean, you're all here, so you've all done brilliantly in realising that this is a really serious topic. But I find a big thing that I'd love you guys to go away with is to take away from this is to educate your fellow parents, coaches, athletes, other first aiders about why concussion is important and why, and hopefully give you a bit of confidence to make that stand, to look after our athletes. So to be the one that says, this could be concussion, I don't think they should go back on the pitch. And it takes it's a brave person to do that. As doctors, and certainly as sports doctors, we're very used to it. The patients are our number one interest. And it can be very tricky when you're really part of a team and you've travelled for a season with a team and it's finals, grand finals, and this is a star player. But thankfully for me, I find it always shines through that this person is this athlete, this star goal kicker is a player at the end of the day who I have to look after their health. So if we talk about a bit of the few potential complications of I guess of a few things. First of all, this is all a bit medically technical, but the biggest worry with if somebody has concussion or a knock to the head that we don't bring them off for, there's a dreadful condition called second knock syndrome. Whereas if somebody's had a concussion and their brain has swollen a little bit from that initial injury, if they were to get a second knock, there seems to be a cascade that can fire off within all the inflammatory markers and actually can cause so much swelling it can push the brain down through the brainstem and be fatal. There's been a couple of deaths recorded of this in the US. So that I don't want to sound coming too hard, but this is where we really have to be careful. That second knock syndrome is what scares me the most in kids sport, probably more than anything, because we don't have that level of AFL. Great, they've got Hawkeye cameras, they've got a concussion person who's watching for a concussion, watching every camera angle for it. But in kids sport, we just have to be careful. And I don't want to scare you. It is a very, very rare thing, but it's something we should just be, because this is a big reason why we're pulling people off, why we're taking the time to assess them and make sure that this isn't going to happen. So a single knock, very, very rare. This is more that second knock when the brain's already a little bit sensitive.
So in terms of time frame, that are you meaning like within the same?
Yeah, almost immediately. It can happen immediately. It can happen within seconds, minutes, hour. Yeah, usually, to be honest, seconds or minutes of that second knock. Could be within the first 4 hours is an ED when we really watch, concussion pain. And that's what I would guide your athletes going home with mum or dad, even adult athletes. That first 4 hours is the key. If something's going to progress negatively or deteriorate in condition, that's when it tends to happen. If there's been a bleed that we've missed, they've just presented with a mild headache, but it's just been a little bleed and it gets more so, that's when they need to definitely be with someone. We say for 24 hours, but certainly that first 4 hours is absolutely key. Doesn't have to be staying pitch side, it can be going home, can be going to bed, can be, going to sleep, and we'll talk about that a little bit more. But definitely needs to be monitored and regularly checked on. So thanks for good question and good interaction. So again, complications of a concussion that we either don't manage by bringing them off or actually return to sport too quickly. It can actually prolong the symptoms that they're getting, the headaches and the things like that. Oh, great, they can hear. Okay, yeah, excellent on Teams. Longer term, I think we've all heard in the news, and Melissa and I were just discussing some of the cases. We might have heard these ex-footy players who've had some mental health issues. Unfortunately, even we've had some suicides from what we think is probably some post-concussion damage. Unfortunately, there's no scans that can tell any of this. It's on post-mortem examination that these conditions are found. So thankfully, part of this new international concussion group, they're studying this. They're looking into this. Are there ways that we can pick up those at risk with multiple concussions? Are there a number of concussions that we should say that? And obviously, that's a really, really tricky thing to be doing with sports people and professional sports people. There is a thought that concussions could lead to depression, and this post-concussive syndrome is basically a prolonging of recovery from concussion. Some risk factors for why people might not recover so well, or why they might take a bit longer to recover. Certainly premature return to play. So going back to sport too quickly, and we've got within here. There's a couple of sheets. There's so many different ways, different flow charts, I guess, about returning to sport. They get updated on. I found this quite a straightforward one, and we'll talk through it a little bit later. But basically, it's a very stepwise process where we move from one stage to another, no more quickly than 24 hours. Any increase of symptoms, we go back to the stage before until those symptoms settle. It's okay to move on with stable symptoms. So a bit of a dull headache, we can keep moving on as long as it doesn't get worse. I think there might be a bit of genetics involved in who gets concussions more easily or doesn't recover from them, but nothing that's boiled down to anything that's helpful for us to look into with our own kids and families. Younger age athletes tend to have just mainly longer recoveries, whereas we'd say an adult will come to a minute 7 to 10 days. We say kids often 4 to 6 weeks is more likely, but we have to have 90% of them recovered. Females seem to also have come off a bit worse from concussion, and if anybody's ever had migraines or anxiety or depression. But yeah, it's lots more research coming into action. Like I've said, if in doubt, this is why we're sitting out, and also why we're slower to return to play. Now, hopefully this is a bit of the practical, interestingly, training day management as well. I think we're very clued up and ready to act, aren't we, on game day? We have a first aider in their jacket, whatever. But training, actually, I mean, the balls are still flying in hockey, aren't they? The rugby tackles, if anything, players aren't necessarily as absolutely switched on potentially as other times. I've had in the talk I did in Bunbury, I had a couple of school nurses. And you're interested in school. You can imagine kids in a playground where they're not really monitored at all, the amount of head injuries that really could be happening. So it is worth educating even your own kids that if they see a friend who trips or falls at school and is a bit dazed, if they ever fall and they've got a bit of a headache or anything, definitely to be reporting it to somebody, even if it's resting them from that lunchtime play and they're called to at home. Now, I think the most important steps, in the management of concussion is recognise the injury. I'm a sports fan myself. I love watching sport, but I find it quite funny when I'm being a first aider or a sports doctor in sport. It's not a great spectator sport because I find I'm almost watching 5 to 10 metres behind the ball. In rugby, I'm waiting for the players to get up from the tackle. In hockey, I'm kind of just checking if any. Luckily, people don't tend to fall down as much there as footy and rugby, but you're just checking that anybody from a short corner hasn't, had a ball kind of glance off of their mask or their face. You almost make it watching for any evidence of tackles, balls that could be causing a concussive injury, because that's one of the signs is how the player reacts after the injury. That's something that we can help us to make the diagnosis. And I'll go into it in a bit more detail. Any doubt at all, a player's laid on the ground for an extra couple of seconds, then jumps up and dusts themselves off. But if they did just stay down a bit longer than was normal, please bring them off. Please ask the coach to switch around and just take a little bit of time, even just chatting to them first of all, any symptoms, but certainly this is when we can use this and we can talk through things. That's a bit of the medical assessment. So the first two can be done by anyone and it's great for anybody to be doing it. And step three, obviously the medical assessment, that's further on, is done by a doctor. Certainly removing the player and doing it, a concussion recognition can be by any of us as parents, as first aiders. So I guess to think about definite concussion. So anybody who has an impact to their body or head and loses consciousness, so is not moving on the floor, a definite concussion. If they look a bit wobbly or unbalanced, we'd really worry about there was something like that. If they're incoordinated, if they appear a bit confused, there's some videos on concussion where the players start kind of dribbling the ball the wrong way down the pitch. They kind of can appear that they're still got the skills, but they're just not quite acting as you'd expect them to. Probable or possible concussion. This is that lying on the ground just that bit too long, a bit longer than you think. Rubbing their heads. Some kids might do that, shaking their heads. Certainly any cuts or bleeding on their head, we definitely need to bring them off. One, to check out that and manage that, but that is a bit of a worry that if something's been impactful enough to cause that, then we should assess for concussion. And they may have a bit of a dazed or blank look. We should really ask them when they're off on the pitch side. Ideally, we'd love somewhere quiet with no distractions. That doesn't really happen, does it? In year 3 footy on the side of a pitch, someone's 6 p.m. at night, someone's in the rain, or so basically. But I would love you to have a bit of space with them. If you can kneel down in front of them and just have a bit of a look at them, kind of check they're making eye contact, but just chat with them. Have you got a headache? With kids and adolescent athletes, I'll often go through these symptoms like, what's your vision like? Are you hearing all right? How are you feeling? And this is they've divided it in this new one into physical symptoms, changes in emotions. Sometimes people are feeling sad or appear a bit more anxious. They might feel like they're in a bit of a fog. Obviously, these things might take a while to kick in almost, or for them to recognise, because they've got the adrenaline of the game. So I'd love if you could have them on the bench with you for at least 5 to 10 minutes. Often that's the way, isn't it? If a coach has subbed the player for that time. In, like I said, in the AFL, it's a minimum of 15 minutes off for any head injuries that they have. We don't always get that luxury. Symptoms can be delayed. Concussion is an evolving injury. That's why I love, please buy yourself 5-10 minutes until the next half, the next quarter, to just let the I was gonna say patient, but let the athlete catch their breath, have a drink. I just like to watch them for, to be honest, I say at least 10 minutes if you can, but really just to make sure, and then check in again kind of after 5 minutes. How are you doing? No headaches? You look around, you're not seeing any double, you're not having any blurred vision. And asking a few of the questions. Players might try to hide or not report symptoms. It's ever so common, unfortunately, if they're, but also the adrenaline of a match and and in the match, or they are actually a bit dazed and confused and aren't aware that they've experienced a head injury. I think this education is getting out there, or the word about concussion is getting out there. I've got a poster in a mo. I'll even come across to it. That's where we use this concussion tool. I'll show you it in a minute, but it's an American poster, and I'd love it if it was up in lots of changing rooms. In a mo. Just to kind of warn athletes or educate them really that better to miss one game than the whole season, and that can sound a bit extreme, but to be honest, if they carry on playing and then even for the rest of that match, and that then prolongs their symptoms onwards for 3-4 weeks rather than the 7 to 10 days, that's been a worse outcome for them. So this is an American poster, but I can always look for some. Now, I'll catch my breath and check for any questions at the moment at all. I thought we might talk through this concussion recognition tool a little bit, because like I say, this is what you might go to and grab. I've actually got the concussion recognition tool 5, is what we always had, and you can see it was recognised Olympics, FIGBA. I think I almost preferred it to concussion recognition. It was one page. I just like that one page, and obviously this is 2, and they've tried to improve it by dividing it in sections. But I like bits of it, so we'll maybe talk through it both it's just sort of nothing much has changed at all in the wording. And I think the first thing that I've mentioned is just reasons why we might call an ambulance. And I hope this can help you out because, yes, this is a concussion talk, but also players can have injuries worse than a concussion or not severe. So we've mentioned a little bit about this, but certainly any change in conscious state, if they're vomiting, if they feel any weakness or even numbness tingling in their arms or their legs, that can be a sign of a bleed on the brain, putting some pressure on nerves. Any double vision, certainly, obviously, any fitting, seizing. What I like to remember as well is let's remember our first aid. And like you said, it's not necessarily specific, but it is great to have that instinct of danger. We can be tempted to run straight on a pitch, and that's where we want to be. But we need to be aware that a game needs to be stopped before we're accessing that pitch, else we're putting ourselves at a chance of injury. So umpires, referees, do you find it getting better if a player's down at stopping games, or what are your experiences of that? Yeah, I guess it's if they're seeing it, if it's behind the play, but yeah, so I'm finding that they seem to be. And yeah, so looking for danger, just Dr. ABC, so checking the person's airway, breathing. We're not trying to quickly move anybody off a pitch at any point, off a court or off a anywhere they might be, but in case they've injured their neck in a fall to the ground or even a head injury. So don't remove a helmet. Even mouth guards, don't try and wiggle them out if they seem to be up and they're nicely tight if the player's laying down. They could be a stroking risk. So if the mouth guard's looking like it's coming out, it's all askew, definitely worth hooking that out and getting rid of it if a player's laying on the ground. I'd love you guys to almost have chatted through some protocols of if a player's on the ground and you're going over as first aid, who you want with you. And it's actually minimal people. You don't want, it'd be really great if a coach knows that if a first aider's with a player, please take the players, take them all for a drink, both sides, go and get a drink, give that first aider some privacy. Anybody, if you're ever not a first aider on the pitch and someone's there, definitely I'd love another person going in to help that person, even if that makes sense. So the first aider's there with a player. It's always nice to have a fellow adult there with you, even if it's just saying, what do you think? Like, do this? Can you ring? Yeah. Can you ring 000? Yeah. Can you find their parents? See if this is, their normal, behaviour. And just to give them some reassurance that. Any questions on any of that first aid type things?
Someone does go, I was at a game where a player did go down and it was an injury, and I can't remember whether they weren't quite sure whether it was concussion or not, but they were down on their hands and knees, I think, for a couple of minutes, and the game stopped.
Yeah.
But then they insisted on playing on.
Okay.
So how do you get that player to, because it's really not up to the umpires.
Yeah.
How do you get that player to go and sit down that 10 minutes? So that's the hardest.
Yeah, it really is. And and that's what I hope this filters out education. I think first of all, education to players, because even as a sports doctor, if I in a professional match, if I'm telling the players to come off, I'm respected and they listen. But to be honest, any other level, I don't have authority over the players. I'm often in a voluntary role. So it is a tricky thing. And that's why I think we need to go right back to education of players, education of coaches, support for first aiders. And I've got a bit of a hierarchy thing actually in a minute that says, obviously doctors, if they're there, they're number one, but sports trainers, first aiders, they are the person that makes that call. And I even hope that we can have rules in the game where if someone comes off for a head injury assessment, it doesn't count as a sub, or someone else, because I know certain games have certain numbers of subs that can go on, obviously soccer and things like that. Hockey, we're luckier, aren't we? Because we can make all those switches. I haven't played hockey for a good few years, but I think that's the way, isn't it? That we could take someone off. Whereas certain sports, if a sub goes on and that counts as one of their players, that's a big call to be making. So thankfully, the majority of high-level sport allow a player to come off for a head injury, and that doesn't count as a sub. But yeah, that's a really interesting and important question. I think, to be honest, as a first aider, all we can do is suggest that we'd really like them to come off for a concussion assessment. I mean, it's hard because it's in the pitch and if they're denying, but also suggest that, yeah, we'll do the assessment, they can go back on. But I think at the end of the day, we would struggle, wouldn't we, to actually get an adult player off. I think
it goes back to that. I think that was the.
yes, yeah,
It's about changing culture.
yeah, very, very much.
So
Yeah.
it's not just
Yeah.
educating.
Yeah,
It's a generational thing.
It is.
All the kids
Yeah.
growing up thinking.
yeah. And like we do it for blood in rugby now, don't we? They used to play on with blood on their foot, and where they're fairly good. I don't know about the amateur level, but certainly high level, they come off as soon as they got some blood on them. And that's okay. But so why not put head injury into that mix? Like we wouldn't have a player playing on with a torn hammy, like, or even a badly twisted ankle or torn ACL. Like if it seems like concussion, it would be lovely, wouldn't it, for it to be recognised? Yeah, in that level.
People think that if you go off with a head injury, you come back. I think that's where the prejudice is against. Oh, you've gone off with a head injury, you're not coming back. Where it is just you're just going to have an assessment, and you may not, but you also may.
No, good call. And to be honest, yes, if. Yeah.
Too scared. That's my game.
Say, and is that, and then am I not okay next week in grand finals next week? And yeah, it's really true. And to be honest, so if luckily a lot of them won't have the signs of concussion necessarily, we might have just seen the impact. But even if we see the impact, if they're showing no symptoms after 10 minutes, I'd say ideally, but even after 5, if you've been through it a couple of times and not showing symptoms, it wasn't a dreadful impact, like they weren't laying motionless, they were kind of hopped up a bit dazed, but they're definitely not showing symptoms. It is okay to pop them back on, like you say, for 10 minutes after 10 minutes with a warning. But please, if you get a headache, those symptoms will show with that bit of sport if they're going to. That sound okay? But thanks. This is great, the interaction, because this is real life scenarios, isn't it?
So then you wouldn't worry about the second knock.
Good question. So what they say is so that's where I think it comes into the signs as well as the symptoms. So the tricky thing is we're not always watching every single head knock and injury, are they? So if we're not sure, we didn't really see a lot, but there was maybe a head knock, they come off, they've got no symptoms. The next thing is these questions. I'll just come through this. So signs, I think we've been through that, haven't we? Whether they're lying on the ground, whether they're certainly any of those signs, I'm afraid it is off for the whole game. So probably that on your hands and the knees for a while before we get up. Was he winded? But to be honest, that could be a head injury, couldn't it? And a bit dazed and catching his balance. So to be honest, that ticks one. You just need one single one of these things ticked, and that's a suspected concussion. So it is hard, and we say you might well go back on, but often if there's a reason we've seen them get up slow, that does tick a box. But say we're just concerned, or there was a clash, they didn't stay on the ground, there was just a clash of heads, and then they matched notes. So next we go through to these questions. So we've asked the symptoms, so a bit of a memory assessment. So we kind of asked them, where are we today? You adapt it to kids level, like, which team are you playing for? Who scored the last goal? Luckily, most athletes, most sportsmen would know a bit of that. The tricky thing is there's some of us like, who did you play last week? Some people actually wouldn't have remembered that. So there's a little bit of specificity. I know some of even amongst my kids, some are hardcore and know every result of every season, but other kids might not. So up to you. But those are some more questions that are meant to help with those people that aren't really showing any symptoms, aren't really showing us. Certainly if they tick every box for remembering all that, they're good. That's quite a specific thing. So that 9 out of 10 people with concussion will be abnormal on that, they say. So does that sound all right? I'm afraid, sorry, it's a little bit wishy-washy in that it is a developing field, but I think you can do your very best. You can, if in doubt, sit out. Obviously, you've got that pressure, but so if they're not saying they've got any symptoms, there wasn't a dodgy head clash or anything, and they're answering all the questions, and it would have been 10 minutes almost by the time you've got through all that, you probably are okay to go back on if it sits well with you. If you think, but often it won't, unfortunately, they'll have come off for a reason of a head clash. And then but I think even for our kids, it's tough they missed that match, but you'd much rather they ended up coming home for the 4 hours, you check on them the next day, you check in on them, and then and if anything does creep up, at least you're in that point of managing them. Because I think there will, as the years go on, there'll be more and more research done, so we'll have more specifics. But yeah, it's that education as well. I think it's going to be a key part. I think that's probably what we've been through. Oh yeah, so just not allowed to return to play or train on the same day. It's more high level teams where if they don't get the full match play, they'll go out and do a training afterwards to make up theirs. Or the player themselves might want to go and do some training that afternoon because they missed the match. Definitely not if they've had any suspected head injury. Even running water bottles, ideally not, because that's exertion. We'd rather they weren't doing. So that was the poster. So this is more, I think we've kind of been through, but I'm happy to be chatted to about what I thought might be helpful from your point of view is, what do we do? We've pulled this patient off, or this, sorry, I keep calling them patients, that's my feel, but this athlete off, this kid off. And then what do we do next? What do we tell the parents? I really like the Head Check app. I'm not sure if any of you have come across it. Yeah. Being a footy first aider, I think it was something we had to have on our phones. Even that was year 3 footy, but it is fantastic. I find it's a free app. It's for all ages. So from 6-year-old athletes right up to adults, it gives them a bit of self-management tips, and the parents a bit of self-management tips. They put in their own name, age, date of birth, time of injury or concussion, and then it asks them regularly fill in X number of 0 hours, 4 hours, 24. What symptoms are you feeling? Are you feeling this, that? And it's fantastic. Like, you can go into it as a demonstration as well. You don't have to even put your own details, but you can go in and do a demo patient. Right? It's really, really helpful. So Head Check app is a really fantastic.
I just kind of find if they're under 12 with that, it just directs you straight.
And that is the thing. Okay.
Yeah, so I had a boy. Okay. So he had a headache. I gave him some Panadol.
Yeah.
He really wanted to go on. His parents really wanted to go on. His grandparents had come today, and I said, he's had a headache. I think that we don't know, you should sit off. And then at the end of the day, they can only listen to me. They don't have to say. But if I did do the head check, and it said present to a local or to see a doctor.
Yeah, and that's yeah. So I think
that hard on a Saturday
to show parents, mightn't it, and grandparents, like this is what, like, look, headache is one of the things that tells me it could be a concussion if you're feeling. But so yes, anybody that's shown any symptoms on this definitely ought to see a doctor. ED, not necessary. So certainly ED, if anything worsens over that 4 hours, or if they have any of the red flags that are on the front of that. But yeah, I would say every kid or adult that's had a concussive injury ought to be seeing a doctor. Yeah. I'll come to it in a minute because
be your GP.
Yeah, that's a question. Yeah, and the tricky thing is not all GPs know much about concussion. Again, it's in my med school training, I don't think I did a single thing on concussion. I maybe knew what it was and learned, but it is important that if you can, try and find a GP with at least a musculoskeletal interest. I don't know. Down here, I know Tony Best. I've gone over to Abu Dhabi. Oh, there we go. Lovely. Yeah, I went to Abu Dhabi try with him. So yeah, I don't know. Sorry, boy, he might not like me saying, but do you think he's got that musculoskeletal interest? Oh, doesn't he?
Ex-sports medicine.
Okay, so I'm behind times, but sometimes on GP websites, it might be worth finding out if anyone down here has got. Brilliant, Gary. Yes, brilliant. Yeah, I went across with those two guys to Abu Dhabi. So yeah, so there's some locals. I'm happy to see anyone in Dahlia, GP. Synergy Sports Medicine Clinic up in Bunbury keeps Monday appointments and during the week appointments for those Saturday, Sunday concussive kids. So if you want them booked in with Gavin White's just retiring, but they've got 2 other sports doctors. Yeah, covering. So yeah. But I would, if you can, find a GP with a musculoskeletal interest. If not, we're very good at GPs of searching things. So this concussion in sport is a good way to guide. But yeah, certainly it's quite an intensive exam. I'd always make sure if you possibly can get a double appointment, because any of the assessments do take a while. I'll give you, luckily, this is accessible to parents, to coaches as well, which we might move on to. So that's just showing this is the medical scat assessment, 13 pages. They say allow at least half an hour. You need measured ring tapes and stopwatches. You'd never do it pitch side, I don't think. And to be honest, I don't even know if I do it in my GP rooms initially assessing a concussive patient. I'd probably be more, I feel it's more professional level in a way. I think I'd be more guiding them on return to school, return to play, return to work. That sounds reasonable. When to refer to hospital. Again, hopefully the call an ambulance things, but also the refer. I guess what you'd be telling your patients, if anything worsens, or if you're worried, you're never wrong to send a patient, even with a headache, to ED. They don't have to. If you can feel okay, this is a mild concussion. It's tricky because I guess as a doctor, I maybe have more confidence in that, but even then, all the time as GPs, we safety net. So we tell patients, we're seeing you here and now and you seem to be stable, but if anything takes a turn for the worse, you go into ED. I don't want anybody, I'm not absolutely fine, but I don't really want athletes taking Nurofen. I don't want adults drinking any alcohol, not driving a car and this is for 24 hours. What else do they suggest? Oh, not being left alone. It is okay for kids to go to sleep. There's that whole a bit of an old wives' tale, isn't there? Don't go to sleep. They might not wake up. It is okay, and they're probably going to be exhausted. To be honest, concussion can lead to a bit of emotion, a bit of sadness. They might be sad they've missed the match as well, but it's okay if they want to have a bit of a doze. I would be having door open and as a parent and regularly checking on them. If not, seeing if you can do some work in the room or anything. Just that first 4 hours, like I say, we don't want them vomiting or anything progressing. Any questions with any?
Something else I'd read was like going home or like even playing on devices and watching on TV.
Well done. You've heard lots because that is a big key thing about brain rest. So I'll come, if you don't mind, we'll pause and we'll come back to that in a sec. But I think we've kind of chatted through this a bit, and this would be lovely, wouldn't it, if this was known to if this was on a little chart, but it's not, and it's not about wanting wanting to be top of a hierarchy. It's just, I think as a first aider, we can have that player's interest, can't we? We're not so in the thick of it as a coach thinking, oh God, who's going to fill my defence role? I've subbed off or what somewhere so-and-so took, went off just now. We're very much about this is the here and now with the player. Yes, education will get out there, won't it, to players and coaches. And it's tough for a coach I did, even in one of the footy matches, a kid was down and I saw the coach kind of literally lift him up, dust him off, keep going, which is what we've all grown up with, isn't it? But if that player's on the floor, we probably need to let them just get up themselves just to see, how they're doing. Not return to play or train on the same day of injury. Again, it's all a bit about if there's any suspicion, that is a concussion, if that makes sense, because it's so vague. There's nothing about any doubt. We actually need to be certain that they don't have a concussion to allow them back on it. Sorry if that's a bit technically written. General GPs might not be aware, but that concussion in sport is education for us all, and I hope the word gets out there for them. Sports doctors, synergy. Sounds like we've got a few, like I said, Gary Tapper, Michael Massey, some muscular or doctors with a sports interest. You may know others along the way. Sometimes even doctors who've got kids may well have been on side of sports pitches and done a bit of their own research. So a bit about return school. Ideally, we want that Monday morning appointment because for the kid, certainly if they've got any ongoing dull headache. The back of this book actually shows, I quite like this, I got this from a different website, but a little bit about guiding a teacher on that this kid has had a concussion, therefore they might be a bit more fatigued, they might be sensitive to light and noise, they might feel a bit nauseous. And I mean, this is a doctor ticking these, but as a parent, you can always chat through these with an athlete, like maybe chat to the teacher or message the teacher if you can, or pop in Monday morning. Like, I'm just going to send them in for the morning. Can I pick them up? Or shall we try an hour and maybe I'll check in again after that? Could they have a break? Definitely no homework. They love hearing that, kids, but I'd say no homework for that whole week after they've had a concussion. We don't want anything extra that's going on. I really like your bit about rest as well. Actually, we'll come to that, but return to learning and school takes precedent over return to sport. much as they're reluctant to do that, I think it is really important. Well, that's what comes from all the guidelines, is that's what we've got to start with. And actually that's less dangerous to the brain that trying to go back to learning and the symptoms worsening than trying to go back to sport. So you can balance it side by side, but until they're managing full days of school, I wouldn't have an after school training, if that makes sense. If they're only going for a morning and then they want to train after school, it's best to build up that resilience in school in a safe atmosphere. And the tricky thing is recess and lunch. Uncontrolled playtime, aren't they? So it's tough. As a parent of boys, I don't know what I would do, whether I'd pick them up at, I don't know what you could do at lunchtime, or whether you could encourage them to be playing one of the small, like quieter activities on their Lego blocks. Could they go to the library? Is there something they could do to not be running around with their mates? Because it's all too tempting when the bell goes. Return training. So made by a medical doctor. So that's when to be honest, any concussion, please do link them in with someone. I've, in the last month or two, sent a couple of adult patients with just concussions that didn't get checked out by a doctor afterwards, kind of semi-self-managed, went back to sport a bit, and just we're 3 or 4 weeks down the line and they're still getting symptoms, or even I think one was 8 weeks down the line after a bike crash. And been returned as a full-time teacher and just kept getting headaches, kept feeling nauseous. There's a really, really good neurophysio down here, Fiona Trendos. I'm not sure if any of you have come across her. So she is a physiotherapist specifically trained in the brain, basically, like almost a special interest. She deals with loads of our vertigo patients, but she could also certainly assess. I don't know about her in sports medicine interest, but she'd be worth finding out about. I've sent a couple of people up to Subiaco Sports Med in Perth, have got a fantastic neurophysio. So if you've got kids that are a week or two down the line and they're high level athletes that, you want this to be working well, even if they're not high level, if they're your kids and you're really concerned. Miles, one of the physios, they've got a website, Subiaco Sports Medicine, and they've got 2 or 3 physios. Their physio will see someone on a Sunday afternoon. I've had him see patients before. Miles is fantastic and will do thorough examinations as well as a bit of treatment about if they're a bit dizzy or ongoing. So lots of resources out there. We can start local, but there's plenty up. And obviously the closer we get to Perth, the more there is out there.
Treatments are there, so
really,
my son presents to the doctor on Monday, still like today.
Yeah.
Is there anything the doctor can actually?
Not really. You can have Panadol for the headaches. That's good. But the biggest thing is allowing those headaches time to settle and not allowing them to get worse. So it may well be that a kid does have headaches for that week until they settle, but it's doing a very graduated, so a very steady progression to school, to school hours and amount of focus, and then to return to play, to make sure that every step of the way the symptoms don't get worse, and really wanting for them to be settled within. Adults, they say 7 to 10 days. Kids, they say 4 to 6 weeks. But I reckon if I had a kid that was still having a headache, even after a week, if it was my kid, I'd probably be going to a specific sports medicine clinic just to be sure. Not okay, well, should we be doing anything more? And that sports physio, they do this sports physio, like I say, does do some rebalancing exercise, does do some eye type movement exercises, maybe just to try and get the brain used to a stimulus again. And it's a little bit above my field, or more specific even than my general sports medicine knowledge. But I think trust your mum instincts as well. It's a hard balance, isn't it? But I think
And then so say they've had a concussion, like a physical symptom or a change in emotion or whatever, they went to their GP early that week.
Yeah.
They don't have any of those symptoms.
Yep.
Would hopefully whoever you're seeing knows a bit about concussion, would then they say it's for a kid, how long, or even an adult, till you go back to sport?
Yes, really good question. So if by Monday they have no symptoms at all, I would start with just a work day Monday, and they may find they get through the full work day. Brilliant, still no symptoms. Well, maybe Tuesday before work, after work, they could do a very gentle walk or and go for, and I'll show you actually, I've got this bit of a flow chart here. So this is one, there are lots of ones like this, but basically what we want to do for the first 24 or 48 hours after concussion is it used to be no activities at all. It used to be resting your eyes from screens, from even, it was tough. It was no screens, no books. Yeah, and for kids, imagine saying you can't do exercise and you can't read a book or watch a movie or anything for 24 hours. Now they said activities of daily living are fine. So walking around the house, not overdoing it, probably not hanging free loads of washing even, it's quite nice for us girls to hear, ladies to hear, isn't it? But okay to potter around the house and probably okay to watch. I mean, kids, they're probably, we might want them to chill with a movie if it doesn't make their heads worse. The ideal is nothing, and they may feel a bit sleepy and a bit dozy, and maybe we could read them a book or we could, but yeah, whatever works, and as long as something's not making their headaches worse. But yeah, as much eye rest as you can give them. Then after 24 hours, we've kind of got, which we do a mix of, this is more the sport specific ones. So say they've been, to be honest, kids, it's going to be tricky. I guess you could do Monday, Tuesday, build to full days of school. If they've got, even Monday, you might find no symptoms going back Monday, full day of school, check in with them, no extra symptoms. Great. Well, maybe Monday afternoon, Tuesday morning, you go out for a walk with them, because we can do this in 24-hour chunks. So if we buy ourselves a 24-hour chunk on Monday of back to school, by Tuesday, it could be back to school plus a walk, like a 50, say less than 15 minutes and not getting your heart rate up. I mean, this is a very sport specific one, so it kind of mixes in with some of these other ones here. But like I say, it's basically every 24 hours, you're allowed to go up a step, as long as symptoms haven't got worse. If you go up a step and the headache comes back, gets worse, just go back down to the one before and stay on that until it settles back to what it was. So then some sport specific. So the nice thing about this is even just sociably, kids can be turning up to training, seeing their mates. Certainly if it's week number 2, we say if they've missed a week by building back to school, but maybe they could just jog around the edge of the pitch. Could they do a warm up together? No head impact activities, and that could even be kicking the ball you'd avoid in case that there was. But then within 24 hours, they could do some non-contact training drills. So certainly get them with their hockey sticks at home. I mean, even probably for that sport-specific exercise, that's okay. It's a good test, isn't it? Like with that, gentle movements at home in the garden or on the edge of a water base or an astro, does that flare their symptoms? So. And you can see how within 7 days, the AFL won't let players back for 10 days. They miss a match, basically. We probably ought to be doing that. Probably with kids, doesn't really happen. I think a lot of concussion doesn't even get worked out. But obviously, if they've come by Friday, this was grand final, like let's try and work out the pressure and the need of the match as well. If it's a grand final, maybe we'd have them back by that next Saturday. If they'd had a great week at school, they built up with and no symptoms, they're safe to be back again. Yeah. So it's going to be, and you see there's lots of different ways and lots of different ways to assess it, but hopefully that helps you a little bit with working upwards and knowing. No, thanks so much for your input as well. I'll just check, I don't think I missed too much there. So this is adults, expect resolution 7 to 10 days. Kids, they said more 4 to 6 weeks to get to that 80 to 90%, but certainly you'd have a lot more in those early days. Gradual return to school that doesn't result in significant exacerbation. Lovely. And then just different things we can use, different types of scats for adults, and involve parent. It often happens, doesn't it? Parent, coach, teacher, kind of all together. It's important that and often as a parent, you're the one coordinating a bit of that, aren't you? The balance of the teacher and the coach, kind of both drawing on your needs, and you're the one that is your kid's advocate, really, or your athlete's advocate.
Excuse me, Dave.
Yes.
I'm sure most sports do it. We have an injury. I got one back where they said that there was a heavy adolescent, 16-year-old. So not a child, not an adult.
In between,
Anyway, but all it was head injury and they walked off the field or something. So with that, I always send a copy of the injury form to the class.
Great, yeah.
But this one I went a bit further and said, because it said that it was a head injury, was concussion considered.
Yes.
Sent them a copy of our concussion policy.
Great.
Very happy Australia, and said that if concussion has been established, then she'll need a medical certificate.
Clearance. Yeah. Brilliant.
Come back.
Yeah.
They got back to me and said that they'd been to the doctor and it wasn't concussion.
Right.
But because of just saying it was a head injury, I had no idea. I wasn't really assessed.
Yeah.
So, and Hockey Australia has got a very good, very much like your flow sheet,
Great.
which I'm going to compare both.
Yeah, good idea. I think it is. Yeah, make your own with the best of your. And well done. To be honest, any head injury, it's hard because was it or was it not assessed at the time? But I think any head injury you'd suspect a concussion or would be a risk for concussion. So well, that sounds like it was managed beautifully. One thing I'd say beware of is that I've had patients come to me for medical clearance and they'll often tell you about a musculoskeletal injury. So they've been sent for a concussion clearance, but they won't always tell the GP it's for a concussion clearance. They'll say, I need a medical clearance. I twisted my ankle at the weekend. I did that. And then we'll medically clear them to be fit to play, but we've assessed their ankle or their knee and they use that form. I mean, it's not necessarily well, it is deceptive, isn't it? But it's passionate. So please, see if they can be, the GP can be told or the patient can be told you need a concussion clearance and it needs to state or head injury clearance, if that makes sense. Hopefully it doesn't happen, but I've had it happen a good few times where, or actually it was a coach at the Bunbury Talk as well who was saying that he's had kind of players come back to him with clearances and he's saying, really? For your concussion, and then it's boiled down that actually they've kind of got through the well, they don't. And I don't think, and if they feel much better, great, but why don't we just do it in a stepwise manner, like for their own benefit? Like it can move along quickly, but we're just doing this for them, aren't we? We want every player playing that can. It's such a tricky balance. And
it's like what you've done. You know, if you follow through with that and you've documented, and if there's now this problem with
there is. Yeah.
There is future things happening in the AFL. At least you've got a step in progress.
Yeah.
Just having one person to go, oh well, I did report it.
That's it. And it's almost easier with high level sport. Like with my jockeys, they have a fall and that's them out for the day. It's this amateur, isn't it? That's a trickier level. And that's why I'm so grateful for all your enthusiasm to come and listen and we'll all work our way through it together a little bit. I find this quite interesting a little bit. There's always questions about helmets. Do helmets prevent concussions? Unfortunately, not at all. So yes, they prevent head injuries or as in skull fractures, cuts, bruises. But unfortunately, they don't stop that shaking of the brain. Like if a cyclist falls to the ground, fantastic, their skull's not being split open, but the brain is still shaking within it. So it was really good. I had the ED consultant at the Bunbury Talk chip in as well with a bit of this. He's a keen cyclist himself. So definitely be encouraged to wear them. Kids in footy and soft helmets or rugby, if they want to wear them, fine. What I would say be careful is please make sure it's not affecting their perception at all. Like, as you can imagine, like, are they able to hear well enough? Are they able to hear other players? Make sure it doesn't catch any of their visual, kind of peripheral vision or anything, to actually make them less aware of tacklers coming into them getting in a good position. Unfortunately, there's a couple of low-level evidence studies that show rugby players that wear those helmets actually get worse head injuries because they feel a bit protected and go in harder for tackling. So it doesn't mean if your kid don't wear it, it could well protect from cuts and bruises, cauliflower ears in rugby and things, but just make sure it's not affecting them in any way and be cautious that it's also not giving them overconfidence.
100%, that's my challenge.
Yeah.
I've got 11-year-old boys.
Yeah.
What?
Yeah, we even brought my son one, like before, as I was doing this talk, and then I thought, gosh, is a doctor giving my kid a hell, like, and the whole team going to then get them, and actually there's no evidence, and yeah, so we didn't, he ended up deciding not to wear it, and it's a, no, sorry, I think I'm leaving things as grey as I am clearing them up, but no evidence that they stop concussions, but certainly definitely encouraged to be worn in obviously cycling, in motocross, any of those, cricket, those things that, yeah, they could.
I see them, that was going to be my next question.
Yes.
In footy, I
Yeah.
see them a lot.
Yeah. So unfortunately, not even the paddy was not known to have died from concussion at all. Certainly cuts, grazes, bruises, yes, hold hair back. Interestingly, lifeguards do. There is some evidence, like 27% protection from concussion, which I've searched through all the evidence, and there's no reason as to why, but let's use them. And I mean, we use them anyway, don't we? They're great for protection of dental protection. Whether it's a bit of an impact thing, it didn't actually say in the medical literature. And again, not high level, but enough for even it to have made it into some concussive literature that mouth guards are a key thing. So, you know, sounds crazy, doesn't it? And I'd love to be able to back that up with a bit more why, but it's, that's everyone, thankfully, in all of us, but not rugby. I don't think mouth guards in rugby. People don't tend to wear them, do they?
Not compulsory.
Are they really? Okay, I didn't think I realised that. Yeah, okay, cool.
Compulsory is they, when you hit the ground, for
Yeah.
example, your jaw comes up.
Yeah.
to the top of your mouth.
Yeah.
That,
Well, that could be concussive force, couldn't it?
yeah, that's
So whether that padding, but then you wonder why not then a soft helmet. But so to be confirmed, but definitely, definitely be good to be worn anyway, aren't they, mouth guards? And good fitting mouth guards. And like I said, just be aware that unconscious patient, that's a choking risk.
Yeah.
Fingering getting that mouth guard out, unless it's jammed up really nicely. Okay, if it's tricky to get it, in, but just be aware. Coming to the end, guys, sorry, it's a bit of a long evening for you. A bit technical, but this short-lived impairment, thank goodness, that's what we want, and that's what we want to promote it to be. Short-lived and resolving by itself, so spontaneously. That's probably 98% of cases. There'll be no trouble at all. But why not let's help them on their way to that recovery with a graduated return to school, return to play, or an awareness, I guess, as much as anything about that. Complications are uncommon, but we just don't know who's going to get them. So let's get everybody through this safely, recognising the injury. So now you might find yourself watching that little bit behind the game, or watching carefully for the tackles and the clashes. Remove the play, give yourself time and space, ideally, space to just do these assessments. And I just hope this can be your backup. This is international guidelines. I'd love coaches to read this if they would, and I'd love parents. This is fully accessible. They want this to be shared around. And like, thanks, Melissa, for laminating this. I thought, how brilliant. If you can tuck this into a sports bag, have it pinned on, notice boards or whatever. I hope it's helpful for
Extra
you.
copies there, guys, too, if you want to take some.
And then some of my references. So, and thanks for your feedback about their head checkup. It's a bit like one of the lines you sometimes ring, don't you? And they tell you, health direct, get everyone, kids to hospital with a fever. So it's a tricky thing. You're never going to go wrong. I've worked in many EDs, and we'll never mind having a kid in. Often we will sit on them for that 4 hours. I did a talk a few weeks ago to the ED, or to the junior doctors with some of the ED doctors there, and I'm going to write them. Well, I've given them bits like this. I've given them things to give handouts to parents. You're never going to, like, if any doubts, even as a first aider, it's too much. It's too big calls to make if you're worried. You put it back onto the parent, you safety net, and you say, if you're concerned, even if they're concerned about a headache, or it's okay to go to ED and get that doctor clearance.
Yeah.
Okay. Does that sound
reasonable?
And even I'd do that as a sideline parent, first aider doctor. I'd be very much safety netting them and say, look, it looks like the headache hasn't got any worse. They've been here for another half an hour now. What do you think? Do you feel happy to go home? But if you've got any twitchiness, just to eat it's the safest place on the bit.
Just ask.
Please do,
So in soccer, is it okay, like, for people to handle people?
Yeah, good question.
Because I'll just use my own son as an example.
Mhm.
So he is obsessed with And like he is really strong, so he's 24, he's really strong, and he literally could go at one end of the pitch and into the goals on the other end. And the force of that,
Yeah.
it really concerns me that of all the sports, you know, where we're so aware of you talking about the indirect force, you know, from another part of your body, causing the head to shake. That's it not being looked at.
Well, good, really good question. We do need it to be looked at because there's no scans. We can only look at a post-mortem a person's brain they get so few of athletes' brain, but you can imagine that it couldn't be multiple impacts with a header. You even see them even scoring a goal, the force or the defenders that defend a free kick or something with a header away. It worries me. That's it. No, the balls are tough, aren't they? And they're with force, so it does worry me. It's and there were research. Thankfully, it's sad, but I read all through the concussion statement. So they put out this statement as well as all the documents, and thankfully, research was a big part of what they want to go forward over the next 5 or 6 years. And they've actually got specific research kind of hubs now that are looking into. What about these players that are getting multiple concussions, but we almost don't realise they're either low-level concussions we're not realising about, so headers, knocks, or multiple concussions. Like, what is the point we pull someone out of this is your 5th concussion? Yeah. It does happen more easily. You'll find on some of the websites there's interviews with there's a hockey player actually, Kookaburra, who had multiple head injuries and has got a long concussive syndrome, and there's an AFLW player and a jockey, and it's just talking about how their head injuries are managed, how they came more easily. Some people by their 5th concussion it doesn't take as much of a force, or it takes longer to recover. So we need research, and we need it to arm us, don't we, almost, to then go forward with better return to play protocols, better protection. Luckily, tackling's been a big thing. AFLW started and saw the worst concussion rate of any sport, any professional sport, because they were getting fantastic athletes and bringing them into a sport they hadn't played for as a kid. So they hadn't learned those protective tackles, those kind of keeping close to the player things. So the concussion rate was awful, and it's gone down markedly in just but that's because the AFL's got the funding at that level to train every single AFL, like every team has had to do this specific protective tackling coaching to reduce head injuries. So that's a bit of the training, but I hope there's more evidence coming so we can work out headers. But how's it going to change the game in the future? I do wonder. Thank goodness, I guess face masks in hockey again probably don't prevent concussion, but they're a relatively new thing, aren't they? And certainly for kids in short corners, and thank goodness for them for some traumatic facial injuries.
Yeah.
Any other questions at all from anybody?
Quoting this person in the duties, I said to the lady that I was taking over, I was like, give me some tips.
Yeah, great.
One of the ones was getting like the flashlight on my phone.
Good idea.
Doing
the pupil response.
Kind of so how effective is that?
Really good question. So we want both pupils to be equal and reactive to light. So shine a torch in one, and we want that one to shrink down. We also want the other one to shrink down. In all honesty, it's quite a major head injury if a pupil if it's fixed and dilated. We worry. Pupil responses changing are potentially late stage or dangerous. So definitely do them, excellent. But we want that pupil shrinking down as you shine the light in it, like both sides, and anything that's not there, 000 to be and that is, it's funny, it's only a pupil thing, but that is. The pupils have something pressing on them. Is there a bleed in the brain? Is there something else? A really good call, because I don't think that is actually, there's no really physical assessment with this.
Yeah, your pupils are fine.
Yeah.
And then there was I was like, oh no, it's not fine.
And you're good. And it could be that it's sluggish. But there's no link. There's
16-17-year-old boys. That a Europe.
And I guess
first check.
Really good question. I'm trying to think in the first aid CPR. I don't think there's even pupils in that, is there? I guess unfortunately, it's such a late stage thing. If someone's pupil is fixed and dilated, they're there's something pretty bad going on in their brain. So thankfully, you rarely will ever see it. We've got to be cautious because hopefully not in athletes, but drugs, illicit drugs affect the pupils. So opioids restrict the pupils, cannabis dilates the pupils. So yeah, there's different, many things can affect pupillary. Hopefully we wouldn't be seeing that in athletes, but it isn't, I don't think it's evidence-based or linked enough to concussion that we would need to do it. Certainly doesn't hurt if it gives you a bit more peace of mind that, yeah, there's no harm in doing it. But I don't think it's the evidence is there from a first aid point of view. I think even when I teach with the surf club, basic first aid, I don't think we don't teach shining a torch in people's eyes. It maybe is more of a medical level thing, if that's it. But not going to do any harm by doing it.
I'm just looking at the players fine.
Mm-hmm.
The player's fine, but they think, oh, I'm not having concussion.
Yeah.
And they probably don't,
Yeah.
if you know what I mean.
Yeah. Okay.
So
Yeah.
how do we deal with that situation? Thinking, well,
I'd back them all the way, to be honest. I would, if there might be something underlying it. Are they apprehensive? Are they, I guess I'll just say I've had jockeys who come up to me and say, I don't want to race this next race. They won't necessarily be telling me why, and I'll try and ask them, but I will back them all the way. I'll go and stand in front of a steward's inquiry as to why they're not racing, because they don't. Well, for me, that's a jockey who doesn't feel comfortable getting on a horse. I don't want them getting a horse that's going to run at 80 k's an hour when that for some reason they don't want to be there. I think the same in any athlete. If they don't feel, even if they're using concussion as a cover for something else, let's back them all the way if that sounds reasonable. Let's support them. They don't feel like they want to be there. Is it that they actually have had a big fight at home with their with someone over, and their head's not in the right space for play? And this is what GPs, we spend our lives kind of almost deciphering why people present with a symptom that may or may not, but there's often a lot underlying. So I just say, if it's okay with you guys, my stand will be I'm the patient's advocate, I'm their player's advocate, and I've got thick skin. I will go to the coach and say, yeah, I don't think they're okay to play. And it's hard because does it open a cascade? Potentially. And that's what you could always chat to the player about. You could say, but equally, if you're at all thinking of anything, go try and take them somewhere quiet, try and get to a change room, try and get to see if they can open up in case they become a bit emotional. Or I guess I'm lucky in my private GP room more often than not, when something just doesn't quite sit right, you explore a bit further and they break down, or something else will come out. But we are the advocate for the kids. Yes. Again, and that can be against the coach or anybody. Does that sound reasonable? Yeah, approach. Yep.
so in rugby it's challenging because you've got kids, a lot of the kids, like I've got 15 boys on field.
Yeah.
10, 11 years old.
Yeah.
I'd say 12 of them ski because it's a long contest.
Yeah, fair enough. Yeah, okay.
So even they lose confidence.
Yeah.
They sit there and go, vision's not. You might say you get concerned.
Yeah.
But then you suddenly realise there's nothing wrong with it.
Yeah.
They're just dealing with confidence.
Yeah.
And they're cold.
Well,
So how do you manage that?
Well, true. Maybe sitting them on the bench for 10 minutes and talking them through all this, and specifically saying, like, follow my finger. Yeah, I mean, it's hard because I do that as a doctor. That might not be. But you could say, is there any blurring? Is there any double vision? Is there, like, you could go through saying, oh, that's good. You're not, and you can spin it positively and say, okay, well, let's make sure there's none of these serious things. Okay, well, that's good. Is there anything you're worried? It's hard. It's not necessarily hard to counsel someone, isn't it, on a bench with their teammates beside them. So it's a tricky situation. They are worried. Do we need to go right back to a training level and be checking in with them and making sure we've got some really safe processing happening, that they've got that confidence. Because I say, even going scared into a tackle is not a great thing, is it? Like to be maybe backing out of a tackle for their safety. So it's sorry, this is going to leave us many grey areas and judgment calls, but I think it's trusting your instincts, using this as your backup, and if in doubt, sit them out. It's hard if that's 12 of your players, but at least this gives you a tool, doesn't it, to work through maybe.
Yeah. How would you manage if a child has a suspected concussion?
Yeah.
And they tell you that they've had a concussion before and it's not like that?
Okay, really good question. Well, it can be totally different as well. So people, it's less common that they've had a concussion before, but it does happen. So we judge each concussion on their own on its own symptoms. So equally, we don't want them to say, well, it's not a concussion because last time I had a headache and this time I don't. I just feel a bit nauseous, or I feel like, a bit irritable. Yeah, I mean, it's hard, kids irritable to the can, but I just, I was gonna say nausea is on there. So, and even nausea, like, as changing these words, like, do you feel sick? Like making it to their level that they can understand. And giving them that time to recheck again at 5 minutes, 10 minutes, and seeing where things are at. Is there a question over here?
Yeah, I find it usually comes down to the parents saying they'll be right, you've done it all.
Yeah.
That second knock syndrome is what you would usually say to a parent.
Hopefully, yeah. And if a kid's needing Panadol, that's not okay to have Panadol and go back on to, because we are masking. It's okay to mask the headache to allow them to sleep when they're home, but never to mask a headache to allow them to play again.
So give them that Panadol.
Yeah.
I see that they should have got.
Well, no, if they've got a headache, so they've got a headache, so if we give them Panadol, we're doing it in you are off the pit, like that you are off out of play today. Have a couple of Panadol, not Nurofen at that point, but have a couple of Panadol, but please, put head check onto your phone, or please know that I want you to be looking up concussion in sport, and just educating yourself a bit the Savo. Please look out. They could take a photo on their phone, couldn't they, of these symptoms, and be asking their kid a couple of hours in, or going to ED. It's tough, isn't it? I know.
Say your kid.
No. And I think all we can do is
just say they're right.
Yeah, and I think it's first aiders. Yeah, exactly. That's it. I think that's it. Document it and very, very much so.
When it comes to changing the culture, like you could have posters and changing. It's always reminding them that it's just and they feel something's wrong.
You guys are helping to move this forward by being here, so.
Some parents are.
So that's the same as well.
Parents, coaches, team managers tend to have like lung fever. And
very, very much so.
Coach might go, that kid's not okay, that's ill. But you can't say anything that will make them.
I find it so hard. So hard as a medical parent on the sideline.
And then it's on them, really. If I saw a kid on another team was unwell, I would say it. Just to say, this is on you, like you're being made aware, because sometimes coaches or teachers, parents aren't aware of it and they might not see it, but if you make them aware and then something happens afterwards, then 100%.
And you can lend this out to another first aider, can't you? I mean, it's hard, it doesn't need tons of training, but you could say, look, I've got it your face in, to go through these.
I'm not sure. It involves a kid. That's our job.
Well, that makes you, that's what we try, don't we? We are their advocates.
Come soon then.
Well, the kids potentially not going to start.
But you also don't know what the teenagers, or for example, trying to get teenagers to rest.
Yeah, definitely. And that's where there is going to be flexibility. Like I say, with boys at home, God, if I had a weekend of trying to say, do nothing, you can't read, you can't, there's got to be adaptations. But so that's where we can, I hope I've kind of guided you a bit that, okay, we'll look out for their symptoms. They're not getting worse, and that's where these new concussion guideline is excellent. It's come into relative rest for the first 24 hours until literally June of this year, it was total rest for 24 hours. So it's relative rest. So they actually encourage a little bit of moving around, not bedbound, actually doing some activities of daily living. So what does that mean? Doing things around the house, even a gentle stroll if they feel they're getting a cabin fever, but just doing going carefully and giving everything 24 hours to check.
And as you said, not making the symptoms worse.
That's it. It's okay to do things with this headache. And we wanted to say, what if it takes 2 weeks? Well, it does if it's not getting worse, but like I say, trust your instincts as well. I don't know if I'd love a kid with a headache to even 10 days, I'd probably be at that point be thinking, okay, I'm gonna maybe go up to a sports doctor, physician. Cool. Well, thanks so much all for coming along. Yeah, thanks Melissa for setting this up. Is there anything that you wanted to say on? Yeah. Thank you. No worries at all. Yeah.
Thank you, that was great.
I have my contact details if any other questions.